are, man. You're making it go. Now, here we go. All right. Welcome to the first Kansas Regional Report Out for the Southwest region of Kansas. These calls have been set up with under the thought from Governor Kelly and Speaker Reichman and Senate President Masterson to try and get information out into the different regions of Kansas of what's happening in their region. These calls won't be prescriptive in any form, but more to let people in their part of the state know what's going on. We have elements that are available from a statewide perspective and numbers that are available from a county perspective, but healthcare systems really are regional. And I think we're hearing from a lot of people that they want to know what's going on in their region just beyond where they live. So these calls will be at this time, the same time every Tuesday at 4 o'clock. And you can watch it live on the YouTube channel. I encourage you, if you can't make it, to go to the website at the state COVID response. It's covid.ks.gov/report-outs. covid.ks.gov/report-outs. You can sign up there, and after these things wrap up, an email will go out to you with a link to this conversation and the dashboard, so that you can consume this information when you want. These are a snapshot in time. On Tuesdays, healthcare systems are dynamic and these things change, but should give you an idea of what's going on in your area. The flow of these calls we'll start from a public health perspective and hear what's going on from a testing and positivity rate in those areas, and then that'll flow as those numbers do into what's happening with our hospitals. The hospital trends tend to mimic those 3 or 4 weeks later, and so we'll hear from some folks in the public health and hospital side, and then a little boots on the ground. Now, I will say we stood this up very quickly, and so everybody that's on this call has been so kind to jump on with very short notice. So we're really just trying to get some information out to paint a picture for what these calls will be like. And next week, you'll have a little more information. KDHE, next week we'll have an additional dashboard we can share with regional data. We'll also have data from Mission Control, which is the software the hospitals are using on transfers to give us an idea of how the transfer situation is going when someone needs additional care. And then I like to end these stories or these times with a bright spot story. They're pretty heavy calls, and this is hard information to swallow, and it's good just to be reminded that there are people leaning in to bring kindness and light into the world. And so we'll try and find one of those from your region. Now, we're not going to have time to do live Q&A, but we have set up an email address, ksregionalreport@gmail.com, ksregionalreport@gmail.com. And you can email us your questions. Just tell us you're from the Southwest region and you'd like to hear about X, Y, or Z, and we'll try and incorporate that into the next call. You can also share bright spot stories that you are aware of, and we'll try and share those too. So that is ksregionalreport@gmail.com. And we'll get started here. Thank you guys for joining us. And we'll get started here with our first guest, Jeanette. From Hodgman, if you can just give us a little bit of some thoughts from the public health side as you've been dealing with the pandemic. Jeanette, were you able to hear me?
Yes, I was. Okay. I was muted and didn't know if I was supposed to unmute or not. As you stated earlier, things have we've just been trying to do our best, and this whole meeting has came together very quickly. So I do not have any regional information at this time. For Hodgman County, we have 131 confirmed positives. We have 528 patients that have been tested. We are currently setting at only 4 active cases for Hodgman County right now, but we have had 4 deaths for our county, which with a county that only has less than 2,000 people as a county, the 4 deaths is, you know, really hits home. So I do know that health departments across the region are, you know, just busy trying to keep up with COVID things and to keep up with their regular health department duties. So.
Thank you very much, Jeanette.
Yep.
Edith, anything you'd want to add? I'm just put you on the spot. If there's not, that's okay. Edith from
Hi,
Scott.
good afternoon. I'm Edith Triangle. I'm the administrator. For some reason, I'm not able to get my video to come on, so I'll work on that. But yeah, just like Annette said, we are just trying to keep up. It's a struggle to trying to maintain our normal duties. We kind of reschedule a lot of things at the beginning of this, and then we were trying to, you know, continuing to do what we normally do and still keep up with COVID. So our population's about 4,800, and we have about 40 active cases right now. We've had our 9th death yesterday, and we've had over 400 confirmed cases, and then about over 100 probable cases. So definitely quite a bit for our county.
Thank you, Edith and Jeanette. And you'll hear this consistently all across healthcare systems. Man, people are maxed out in the COVID response and with what they're doing, and they're generally having to deal with very heavy issues and things as they go about it. So really appreciate all you're doing and cutting out some of your time to be here. Like we said, we'll have regional dashboards next week from KDHE on the Hospital Association dashboard, which should go out with this presentation. You'll see, in October for this region on a weekly basis, about 500 new cases a week. And that really went up in November to where you had, back-to-back weeks with over 1,200 cases in the middle of November. So that's quite a surge in a pretty quick amount of time. It's come down a little bit since the peak there, the week of November 23rd to this last week at 842 new cases for this Southwest region. The map, if you're trying to figure out, what's included in the region, is on that website I shared earlier, and you can see kind of what it covers. Now let me pass it over to Mary Adam to talk a little bit about what's going on with the hospitals in the region. Mary?
Thank you, John. You give me a perfect lead in for, I'm sharing my screen now just as a baseline for the healthcare coalitions across the state of Kansas and how we've been divided into the regions as far as these reporting groups. Today you're on the call for the Southwest Kansas Healthcare Coalition. We call that group SHIRT out here. I'm based in Garden City. We have 18 counties. And so those are the 18 counties that you will see in the COVID dashboard that I'm going to share right now. This is what also John was alluding to as far as our statistics from the last week from the Southwest region, from those 18 counties that you saw. We are on the downswing as far as our numbers, but we're still sitting at 842, which, as John mentioned, back in October, we were at 500. And that is because we peaked so high right before Thanksgiving. And I think part of the reason that we are declining in our numbers is we had some healthcare representatives, physicians, and caring people in our community in some of our cities go to their city commissions and their county commissions and beg them to mandate mask wear. And so Garden City, Finney County now mandates masks, and I think that is helping. But as you see here, we have 18 hospitals, 100% have reported. 50% of those hospitals are anticipating a critical shortage of staffing this week. That's a lot. We have 72 COVID patients, 77, that'd be that we have 5 more on top of those 72 that are possible COVID patients being cared for in our hospitals. ICU beds are critical at this time. We do not have a lot of ICU beds in our area. As you can see, we can't count total ICU beds. We have to count total adult staffed ICU beds due to our shortages of staffing in our region and across the state. So we have 24 adult staffed ICU beds. Only 5 of those are available right now, and that this would have been as of probably Monday at noon, yesterday at noon, I think is when this data was compiled. So, you know, that's not a lot of beds for ICU patients to come into. I'm going to stop sharing my screen now. And I want to give this back to Megan to host. And then I just had, John, a few more comments, if I might.
Yes.
Our SHIRT Healthcare Coalition has been managing the COVID response in our region since it began earlier this year and have done an outstanding job. And so I'd like to just go over some of the information that they shared with me as far as what our hospitals are experiencing now. One of the things is transfers. They're not as difficult right now because there are some open beds, but they have faced times when it has taken them a full day to find a bed, and some patients are transferred out to Colorado or to Kansas City, which, you know, that's a long distance for the patient and the family, and it's staff time dedicated and provider time dedicated to trying to arrange those transfers. As far as PPE, they say they're okay in most areas right now. There was some concerns voiced regarding HEPA filters, disposable masks, gowns, and N95 masks. But what I want to hit on is staffing. I know you've probably heard about staffing out there in the general public, that it's a concern, but why is staffing so difficult right now? And I just wanted to give you some food for thought as to why our hospitals and our long-term care agencies are so short-staffed right now. They have the illness themselves, or they're in quarantine. They're working longer hours, they're working extra shifts. They're experiencing their own grief, their own loss. Some of them are resigning just because they can't handle the stress of what they're having to go through in these hospitals right now. We've oftentimes relied on contract staff, hiring nurses from outside to come in from agency, and those are next to impossible to find as well. There's an increased acuity of the patients being cared for in our hospitals, not just our large hospitals, but our small hospitals. They're keeping COVID patients longer, and that takes additional staff time to care for those patients because they are more critical. There's still those continued non-COVID patients requiring emergency care and acute care. And there's step-down transfers from the tertiary facilities coming in for the tertiary facilities like Wichita and Kansas City to open up their beds. So those are coming back. They can't go back home because they're still too sick. So those are being transferred into our facilities. We do include long-term care facilities in our coalition. Many of our hospitals have long-term care beds or swing beds, and that's a whole different ball game. And those poor staff members, they are dealing with so much in dealing with the elderly, not having visitors. If a COVID case comes up, they have to test once or twice a week, all the residents and all the staff. Then they have to continue to meet all the regulations and go through surveys, and you know, it's all those things. And I don't want to take too much more time, but I do want to let you know that the facilities are offering extra pay and bonuses to their staff members, but there's just so many hours these staff members can give of their day. And so, you know, staffing is critical, and I don't know the answer. So what we need to do is get our numbers down. We have flu season upcoming, and now our staff and physicians and health departments are going to have to start working with the vaccine administration protocols. So it's just a multiple number of things that they are dealing with.
Thank you, Mary. I might highlight too, just for people that aren't normally in healthcare, the pinch points usually come around stuff, staff, or space. And in April, it was a lot around stuff, PPE material and things like that, as there was a surge. This one, though there's pinch points around the other two, the main one has been staff, and that's true across all these regions as the main inhibitor. And that's why on the dashboard, you'll see the measure of hospitals anticipating staffing shortages in the coming week, and that makes a difference. And these numbers it's just so dynamic how quickly it can swing or change. But the stories, if you're interested, there's a powerful story in the South Central region from a doctor in Lyons that talked about what happened is it took a long time to find another bed that could handle a tougher situation, and the patient is typically deteriorating as they can't get the right tools and care as they're waiting to try and find a bed somewhere else. And so those are some of the real consequences. And I'm sure it's just not normal to be sending patients that far away when you're talking about Kansas City or Colorado. Generally, there's availability. So we're really in kind of new territory and irregular territory for a lot of folks.
And I neglected to introduce Amanda Vaughn. John, she is an administrative team member at two of our region's hospitals, St. Catherine here in Garden City and Bob Wilson in Ulysses. And I've invited her to provide a ground report from her hospitals if you're ready for that.
That'd be great. Welcome, Amanda. Thank you I know you're super busy, so thank you for taking time to join us.
No, I'm glad to do that this afternoon. Thank you for the opportunity to join this call. And so I'll just give you kind of a report out of what we're seeing at both of our facilities in Centura Health for St. Catherine Hospital and Bob Wilson Memorial Hospital. So consistently, probably for the past 3 months, we've been running a COVID positive or PUI census of between 19 to 25 patients at St. Catherine Hospital in Garden City. And so we have designated our entire second medical floor at this point as our COVID unit. And actually 50% of our overall med surge admissions at this point are COVID related. And so what we've done recently, again, we did this back in the spring, but we just reinstated probably 3 weeks ago now, a multidisciplinary committee, including physicians and staff, to really limit our elective surgical cases again, and going back to just really urgent and time-sensitive cases, because we do have a shortage of nurse and clinical resources to continue with our regular surgical schedule. We monitor the number of COVID-related visits in the ER, and so our ER visits have been ranging anywhere from 30 to 50 visits per 24-hour period. And of those visits, 25% of the total relates to COVID. And then probably half of those 25% get admitted to inpatient requiring some additional care. I will say that Finney County has a 48% positivity rate when looking at the testing. And then the other thing we have, besides nursing shortages, we have ran into some physician resource issues with intensive care coverage and with hospitalist coverage. Fortunately, because we are part of Centura Health, we've had several physicians who've been able to cross over because of the waiver in Colorado and help support our hospitalists to manage these census on the COVID floors that we're seeing. At any given time, we have up to 50 associates off, either for testing or because they're symptomatic or requiring quarantine. And so it's really put us in a difficult situation. We've had several requests for agency staffing. At this point, we only have been able to fulfill one agency position, and that's in the intensive care unit. Although we've probably requested 12 total agency positions, just not able to even find contract labor. And so in addition to trying to support the nursing staff as much as possible during this time, we've implemented a program called Helping Hands. And so we give non-clinical staff some training, and then they can go upstairs and help support nurses in whatever things they can do that does not require licensure, whether it's just helping to refill supplies or get water or whatever our non-clinical staff can do to help support the care needed on the floor so the nurses can practice at the top of their license. And I will say a couple of other things. We have an 8-bed intensive care unit, which is running at capacity for the last 3 weeks now. And typically 5 or 6 of those patients are COVID positive, requiring ventilation. And so we've seen much higher acuity in our ICU than what we've been previously accustomed to. And also in our search for nurses, we ended up capping our physical acute rehabilitation unit to 5 patients so we could redeploy some of those nursing positions to support the medical floor. And we have an inpatient behavioral health unit at St. Catherine Hospital. We closed our inpatient behavioral health unit to try to redeploy those clinical RNs to the most urgent need to care for the medical patients. And then in Ulysses, Bob Wilson Memorial Hospital, we usually only have 2 COVID positive patients in our census on any given day. Most of that relates to just the inavailability of staff resources. And so that's kind of what we're seeing here in the 2 facilities, Centura Health, St. Catherine Hospital in Garden City, and Bob Wilson Memorial Hospital in Ulysses.
Thank you, Amanda. And just translation, most people know this, but when you talk about more acuity, it's the severity of the illness or the treatment that they need. It's just as a translator to non-healthcare folks. And I think you answered a question a lot of people, why can't you go hire more people or find, and what was happening in the earlier parts of the pandemic is it was kind of rolling, surging different parts of the United States. There were traveling nurses and more available. Now that's surging everywhere. Those resources are really strapped. So thank you for highlighting that. Appreciate everybody. Let me see if anybody else that's on the call has anything they'd like to add before I begin to wrap it up. Mary, anything you'd want to add?
No, just thank you for coordinating the calls, John, and to the governor and everyone for providing resources for it so that we can encourage folks to keep sticking to the washing your hands and distancing and wearing a mask, because those do help.
Yeah. Edith and Jeanette, anything you'd like to add? No.
No, thank you. Thank you for the invite.
Jeanette, I saw you unmute yourself.
No, I don't have anything to add at this time.
Okay. Yeah, Amanda, I appreciate, you highlighting this too. And Mary, we heard it in your report, and I'm hearing it across different systems. The burnout and issue is real too, and people haven't asked to work more hours. I'm really inspired by the Helping Hands Initiative story, just giving people a chance to try and relieve some of the stress that's going on there and thinking how to deploy resources. I'm just amazed at how elastic and dynamic our hospitals and healthcare system in general have been to try and cope and deal with this ever-changing dynamic that's going on. So thank you all for what you're doing and just the tirelessness that's going on out there. And you're doing a great job creating just color around these dashboards. We can see what the numbers are, but you guys are hearing what the reality is on the ground. And these are your neighbors and the hospitals in your region and the public health folks. So appreciate everybody's time. Let me move now to a bright spot story. And I just want to remind everybody, again, we're not doing live Q&A on these, but if you have a question or something you want, email us at ksregionalreport@gmail.com, ksregionalreport@gmail.com. Just mention you're in the Southwest region. We can try and cover a question next week. Also, if you have a bright spot story you'd like to share, that'd be good too. So here's the one I have from Southwest Kansas. A group connected to Research and Extension is promoting the use of an app from the local grocery store to help reduce foot traffic and to especially help seniors so they can safely get groceries. So again, just people trying to find a way how they can help people So a group with research and extension promoting use of an app from a local grocery store to help reduce foot traffic, especially focus on seniors safely getting groceries. So always an opportunity to step in and try and bring light into the world. And we always say in our organization, the darker times, the lights shine brighter. And you guys are all a light to me. Thank you for the work that you're doing out there for your neighbors and in your regions, and for cutting out a half hour of your time today to do this. I hope everybody has a good week. And again, we'll be here at the same time, 4:00 for the Southwest region, every Tuesday here for 8 to 12 weeks, however long this the real crunch of this pandemic lasts.